Homeschooling is sometimes a necessity for Asia Soligo. When she was just 8 months old, she had to have a liver transplant. One side effect was that Asia could not get vaccines such as the one required to prevent measles, leaving her vulnerable to infections. She has to rely on something called herd immunity, which requires 95% of the population to be vaccinated to create wider protection.
I can't do many of the things my friends can. Like if I go to school and there's an outbreak of the flu, I get sent home.
Asia's mother, Cristina, has campaigned for mandatory vaccines, and she's furious at Italy's government for attempting to allow parents to self-certify their children for vaccinations without official checks.
Why does there have to be this risk? It's not a joke. The problem is basic ignorance.
It's not a consideration for this family, who didn't want to use their real names. So we're calling them Mauro and Claudia. They've decided to forego the measles vaccinations for their child. Yet they have self-certified him so he can enter the public school system. Their choices aren't informed by scientific fact, but on debunked theories promoted by the anti-vaccine movement, designated by the UN's health body to be one of this year's worst health threats.
Our research is taken from different sources, some from the internet, some from friends. Medications are important and science is fundamental, but the most important thing really is personal choice.
Italy had been a leader in vaccination strategies, but over the past 4 years there has been a 10% decline in those rates. It's especially dangerous for children. Last year, the country had one of the highest rates of measles outbreaks in Europe. This phenomenon of self-determining medical practices has gone down well with those who are somewhat skeptical of the authorities, such as the doctor who's devising the vaccines and the politician who's implementing them. But the problem is that this populist approach to healthcare is having very real consequences and flies in the face of scientific evidence. Both Luigi Di Maio and Matteo Salvini, the five-star and League deputy prime ministers, say they are in favour of vaccines, but they have spoken out against the current law. In a radio interview last year, Salvini even pushed theories universally debunked by medical professionals, but have been amplified by social media.
People, get confused and don't know if trusting on medical doctor or if trusting on other people that may be also more famous than the doctors. And that's one of the problems we face now.
As the cases of measles continue to rise, some leaders from the populist government surprised many recently by signing a science pact in favour of vaccines. But the damage from the disinformation campaigns may have already been done. Sonia, Gallego, Al Jazeera, Rome.